Welcome and thank you for joining us on One Love, a Wellbeing and Lifestyle Show. I'm your host, Julia Brown, with my co-host, Dr. Peter Amato. Great to have us here today. Today, we have our special guest, world-renowned Dr. Gerald Smith.
We're going to talk about something maybe new to so many of your folks, natural dentistry, biocompatible dentistry. Dr. Smith has really pioneered a relationship between teeth and body. We've heard of mind-body? Well, we're going to talk about tooth and body. And it's a very interesting topic rooted in many, many years of research and science. He's one of the world's leading pioneers in this area and has recognized how many diseases, illnesses, and various dysfunctions that we have in the mind and the body come from the teeth, believe it or not. Fascinating. Dr. Gerald Smith will be with us in a brief moment. We'll have him back with One Love. See you in a minute.
And welcome back to the One Love, Wellbeing and Lifestyle Show. We have our special guest today, Dr. Gerald Smith. Again, welcome to the program, sir.
Thank you for inviting me.
You're most welcome. And today we're going to be talking about dental whole body connection. And he's going to break it down and tell us exactly what is dental whole body connection. Dr. Smith.
Well, this area has been neglected. The universities don't teach it because they don't know that it exists. The occlusion, the way your teeth come together, your top and bottom teeth when you chew, literally is the self-correcting mechanism for balancing the 28 bones in your skull and your spine and your pelvis. It's a very interesting alignment. And unfortunately, when you go to a dentist and they fill a tooth, and if the pressure is off by a hair, it can cause a severe distortion in your spine, causing low back pain. I had a patient who had 8 years of low back pain after a dentist put in one crown on a tooth, and it was hitting improperly. And his wife kept bugging him and said, "Robert, you got to see Dr. Smith." Finally, he acquiesced. He came in. I adjusted one minor little interference on the tooth, and his lower back pain of 8 years totally disappeared.
From one tooth?
From one tooth.
Sorry, I'm just trying to wrap my mind around this. Because normally we have our tooth and our teeth rather, and we take it for granted that, hey, it's just to clean them and not knowing that there's a deeper connection to our tissues, our bodies. So elaborate a little bit more on that,
Sure.
Doctor.
In the 1950s, Reinhold Voll over in East Germany documented each tooth is specifically related to a specific vertebrae in your spine, specific muscles, specific organs. And so when you have an acute situation, then that tooth can signal into the nervous system and directly impact on that particular organ or muscle issues. What was interesting, I had one patient who literally had emphysema, and they had him on steroids for over a year. And I tracked it down to an infection in the jawbone where a bicuspid tooth was taken out 15 years prior to that. When I got rid of the infection in the tooth with frequencies, guess what? His emphysema totally disappeared.
Okay, but we did a show prior to this one in reference to the cyber scan. Is it the same thing, that method you use to get into the mouth?
Well,
also?
You can also do what they call muscle testing. It's very sophisticated. And then we have vials. Okay. Each vial has a frequency of a specific pathogen or heavy metal or chemical. So it's called direct resonance testing, where you can literally pinpoint the actual substance in the tissue.
Wow. Dr. Amato, that's just awesome.
It's fascinating. So we're talking about the realization that teeth are connected to our organs, glands, and systems based on our bite, based on the health and the energy of each individual tooth and its relationship to its corresponding tooth, top and bottom, I would say, as well. And this technology has been being researched for many years now. It's not really celebrated in the mainstream, but Dr. Smith, and there's not a lot of I call them biocompatible dentistries. Dr. Smith calls his patented work basically the dental whole body connection. So Dr. Smith, even the systems in the body, the endocrine system, the immune system, the hormones, is all in relationship to the dental whole body connection.
Absolutely. You know, embryologically, your teeth develop from specific cells. So, for example, your upper front teeth, canine to canine, develop from the neural tube, which gives rise to your sympathetic nervous system. The back teeth, the bicuspid teeth, and your molars develop from neural crest cells, which gives rise to your parasympathetic nervous system. The sympathetic nervous system is like the gas pedal in your car. It kind of revs up your body. The parasympathetic is kind of like the brakes in your car. Slowing things down has to do with digestion. So and each tooth, in addition, is related to specific organs. So if you put a specific material, like a resin, for example, that's not biocompatible, meaning energetically not compatible with that patient, or it has bisphenol A, which is synthetic estrogen, it can target that specific organ or vertebrae because of the toxicity from that material.
But what about if that tooth was taken out altogether? What adverse effect would it have on the organ?
Well, it can affect the energy flow into that organ. So that's a major issue too. In addition, if the tooth had to be removed because of infection, or it was an old root canal tooth that went bad, unfortunately, most dentists, when they remove the tooth, don't treat the bone properly with ozone or homeopathics or ionic silver, for example, so that the infection remains deep in the bone for the patient's whole life. And a perfect example, we had a patient from South Korea, from Seoul, who literally had congestive heart failure for 10 years. And I tracked it back to a strep infection in the jawbone where the third molar was extracted 10 years ago. When I got rid of the strep infection in the jawbone, the congestive heart failure totally cleared up.
Wow.
Wow. Let's talk a little bit about fillings, root canals, cavitations. And are there good ones and bad ones?
Yeah, the only good root canal is when it's extracted and it's on the table.
Wow. Tell us why, Dr. Smith.
Well, we're the only profession that embalms an organ and keeps it in the body. And a dead organ creates a chronic state of inflammation. Wow. And when you have a chronic state of inflammation, you have the janitorial service. It's the fungi, the bacteria, the viruses migrate to these areas of inflammation. And then you have chronic infection going on.
So in other words, when you have a root canal, they basically tie the nerve off,
They
cap it up, fill it up.
They extract the nerve. They literally take the nerve out with instruments.
Okay.
And then they fill it up with a material. Well, sometimes that material could be toxic to the body.
Right.
Okay, is the certain type of toxin, because we know we have the aluminum and we have the other white filling. Which is the best kind of filling that we have right now?
Well, the best kind of filling is no filling, but if you had to choose, you can literally get with serum compatibility testing that's available, or energetically testing each material, because it could still be the best material in the world. However, it may not be compatible with your energy field.
Oh, so it, like you said, the connection with everything, the tissue, wow.
Yeah.
Right.
This is impressive.
We need to talk a lot more about fillings.
Yeah.
Let's take a break, folks, and we'll be right back. Okay, folks, we're back with Dr. Jerry Smith. I want to break this down a little further. Let's circle back, Jerry, on root canals and tell us really in detail, what is a root canal? What does it do? What happens when they're infected and it causes a health issue?
Well, a root canal is a process where a dentist drills a hole down through the top of the tooth and with special instruments goes in and literally extirpates or removes the nerves and blood vessels and soft tissue in the tooth. They then irrigate it with hydrogen peroxide and Clorox, and it foams it up and supposedly helps sanitize the inside. And then they fill it up with a material called gutta percha and cement. Now, the problem is there's nerves that come in at right angles, and those nerves die. So you have living protein material that deteriorates, and it creates thioethers. Thioethers literally are related to mustard gas. So this toxin is being given off into the body at a slow rate, but it can concentrate, in the thyroid, in the thymus, in the heart, in the breast, prostate. And plus, you have about 400 different species of bacteria in the mouth. So you have this infectious component of the equation, plus the toxic chemicals that are being given off from the decaying nerves. And then you have stress in your life, and you have poor food, and that's where you get a breakdown. In fact, there's studies showing that 97% of cancer patients invariably have root canal teeth.
Okay, and I've heard this, and I've had many clients who have this, and that's one of our first lines of order is to send them off to a biocompatible dentist, and there's even a special process. So what would someone do? Would they remove them if they?
Well, if someone had cancer, yes, you get it removed. I mean, I had a woman with lung cancer, and the bottom line is, she had an infection in the root canal tooth, and I said, you got to get this out. And we took it out, cleaned it up with ozone, ionic silver, and homeopathics, and her cancer disappeared.
Okay, so ultimately you unpack the tooth and you put natural products in.
Well, no, you literally have to extract the root out of the jawbone and then curette or scrape out any debris in the socket, and then put ozone in there. And I put a sponge in there. It's a self-resorbing sponge called gel foam, saturated with a homeopathic remedy. My patients literally in 99.99% of cases have no pain and swelling post-extraction. Joseph Eisels was a physician in Germany. Back in the 50s, he said, no matter if you use alternative cancer treatment or conventional cancer treatment, if you have infected root canals, the therapies will not be successful. Back in the 50s, he recognized that. And there's a whole section in my cancer book called Reversing Cancer that, Dr. Eisels goes into detail with this.
Wow, okay. So they get to keep the dead tooth aesthetically, but it could no longer become infected once you do your magic to it.
Well, the thing is you have to take the tooth out of the mouth and then put some type of replacement in.
Okay, so you do remove the tooth.
You have to.
Once somebody has a bad root canal, you have to extract the tooth,
absolutely,
work on the jawbone, and do something different.
Correct. You could put an implant in there, which I'm not a big fan of because it's a foreign body, acts as an antenna pulling EMFs into the body and causes dehydration. You could put bridge work, fixed bridge work in there to fill the space.
Right.
Or a removable partial that can be made. So you have choices.
Sure. Okay. All right. Let's talk now about fillings, metal fillings and porcelain fillings. What are the dangers or the problems with fillings in teeth?
Well, again, it's biocompatibility of the material. Give an example, most white fillings have this bisphenol A in it, which is synthetic estrogen. So it can impact your hormone system. There's other fillers there like aluminum, which gives it the radiopacity when they take an x-ray, otherwise you couldn't see it. There's also binders and bonding agents that they use to bond the material in, which again could be toxic. I mean, I had a woman that had a swollen lymph node for 6 months and it wouldn't go away. And I tracked it down to the fact that the dentist did not cure the resin with the light long enough. So there was reactive resin material leaching out of the filling and getting trapped in the lymph nodes. So it's not only a toxicity issue, but it could be a mechanical issue of not curing it properly.
Okay, and that's with the porcelain?
No, with the resins, but the porcelains are usually pretty safe because it's baked in an oven and glazed, so whatever materials are usually locked into the crown. Okay. That's not a problem. But here's another issue. If you get gold crowns, when you cast gold, it's in a molten state. There's no way in the world that you can get the exact ratio in the alloy for all the castings. So you could have 3 units all cast with the same gold, but each unit's going to have a different ratio, and you'll get galvanic or electrical currents in your mouth from it.
Wow. And the aluminum fillings?
Well, you want to stay away from the aluminum because, again, it's related to Alzheimer's and other neurodegenerative diseases.
So many of us, since being children, all had aluminum fillings in our teeth. Many of my clients, even today, still have them since they were small, and they come with health issues to our office.
Yes.
Well, you know, unfortunately, when they process the public water, they use alum, which is aluminum sulfate, to pull the suspended particles out of the water, and they don't even have to tell you that the aluminum is in there, and you're drinking the public water, so you're getting aluminum that way. Underarm deodorant has aluminum in it. They're spraying these chemtrails that these crazies are spraying in our environment is aluminum, strontium, and barium. So you're getting aluminum that way. When a rocket takes off at Cape Canaveral, there's like, 11 tons of aluminum spewed out into the atmosphere.
Right.
So it's craziness.
Wow. And these aluminum fillings, not only are they bad for us, but they act as antennas.
Yes.
So let me ask you a question. If a woman is pregnant and she has aluminum fillings in her mouth, does that affect the baby, and is she also exposed to EMF fields as a result of that antenna?
Absolutely. When the EMFs get pulled into the body, it actually can, cause autism in the developing fetus.
Wow, and affect the pregnancy in the mother.
Absolutely.
This is amazing, folks. So much to learn about teeth and dental health and its relationship even to electromagnetic fields, which I'd love to have you come back and we would do another show just on electromagnetic fields and dental health. That would be an amazing topic, wouldn't it?
It's exciting technology, and it's not on the 11 o'clock news.
Right. Ms. Brown.
Definitely. And we thank God that you've done your research and was able to impart it to the viewing audience. We thank you again, Dr. Smith.
You're welcome.
Great show. One love, over and out.